Thank you so much, everybody, for being here. We really appreciate your time today. My name is Bob Ferguson, Attorney General for the state of Washington, and we're really all gathered here today proud to announce the launch of HearMeWA. It's the first of its kind helpline system to improve the safety and well-being of young people here in Washington state. HearMeWA provides an easy way for young people to reach out and receive help by phone, text message, or in an app. It's a system built specifically to serve young people, designed with input from Washington youth, as you'll hear more about in a moment. This is the only statewide helpline intended exclusively to serve our youth. The plan is simple: connect youth with the help they need in a way that is safe and easy to use. We all know there's a national youth mental health crisis. Eating disorders in adolescents, for example, more than doubled from 2018 to 2022. The rate of adolescent depression doubled from 2009 to 2019 to nearly 16%. According to Forbes, nearly 58% of Washington youth with depression do not receive mental health services. In 2021, 22% of students seriously considered attempting suicide. According to the Center for Disease Control and Prevention, 1 in 10 attempted suicide. And LGBTQ youth are more than 4 times as likely to attempt suicide as their peers, according to the Trevor Project. Finding help is not always easy, especially for young people, and especially for young people in rural areas, for example. Whether the issue is bullying, social pressure, suicidal thoughts, substance abuse, or even threats of violence, HearMeWA can help direct youth to the right place. Put more simply, HearMeWA is a resource that will improve and even save lives. From its inception, HearMeWA has centered the experiences of youth who deal with these issues every single day. We have built this system from the ground up with input from young Washingtonians, our advisory board volunteers, many of who are here today, and hundreds of stakeholders around the state. I'm joined today by members of our youth advisory group. These exceptional young people are helping us and holding us accountable to delivering a quality service that meets their needs and the needs of their peers. The folks you'll be hearing from today include McKenna Crosser. She'll be speaking after I speak. I'm also joined by Connor Mertens. He'll be following McKenna. And former State Senator Sharon Brown will be our last speaker. I do want to take a moment to mention that Connor and Senator Brown, again, both of whom you'll be hearing from shortly, were the driving force behind the idea that became HearMeWA when Connor was a college student. And Jessica Jackson, director of the Sandy Hook Promise Crisis Center, is also here and available to help answer questions. I also want to thank my team. When the legislature asked us to help lead this effort, my team stepped up as they always do and done fantastic work. Camille Goldie from my team may be helping to answer questions as well. Erica Chang, Carissa Lacerda, and Montserrat Jauregui are all here as well and part of a team that's done extensive work working with our youth to bring this project into the place we are today. Over the past 3 years, they've worked to build relationships statewide that have helped shape HearMeWA. They engage with hundreds of stakeholders across Washington state that serve the youth we are trying to reach, particularly those who are vulnerable and underserved. So I'll do briefly is talk about how we started this journey, how we got here, then briefly explain how the program works, and then as I mentioned, you'll hear from McKenna, Connor, and Senator Brown, and then we'll take your questions. The way we'll do the questions, I'll start with the folks in the room, and then if there's anyone on the phone line who wants a question, we'll take your questions as well. So how we got here. HearMeWA started, as many great things do, with the grassroots planning at a kitchen table. This happened to be at the Tri-Cities in 2016. So this has been a project many years in the making. That led to years of community collaboration. And in 2021, the state legislature, led by State Senator Sharon Brown, dedicated funds for our office, the AG's office, to create a statewide reporting system for the safety and well-being of youth. Nothing like this has existed before in Washington state. Our team spent the past 3 years building relationships with groups that work directly with young people every single day to support them through their most pressing challenges. Between 2021 and 2023, to give you a sense of scale, our team contacted more than 1,300 youth-centered organizations and held more than 500 meetings with all of Washington's 39 counties represented. Here's what we heard. Youth say their communities, especially rural communities, lack sufficient resources they trust with everyday challenges they face. They do not always want to call 911 because 911 is not always the solution. They might not know where to turn for support on housing or gender identity or bullying, to name just a few. HearMeWA connects youth in those situations to trusted adults who can triage their needs and get them help. Here's how it works. Youth or concerned adults, by the way, can call 888-537-1634. You can text HearMeWA, HearMeWA. You can text HearMeWA to 738477. And you can visit a website, of course, hearmewa.org, or download the HearMeWA app in the Apple or Google Play stores. All of these options are live right now, including the app. Washingtonians who report through any of these channels will be asked some basic questions about the issue that motivated them to report. Those reports are immediately received by trained crisis counselors at the National Sandy Hook Promise Crisis Center. This National Crisis Center, the only one of its kind, by the way, already serves 3.5 million youth all across our country, 24 hours a day, 7 days a week, 365 days a year. The reports are triaged by urgency, the most urgent being situations that threaten someone's life or safety. Then the reports are sent to community responders who mobilize to get the youth the help that they need. The types of responders vary widely. They include schools, where youth could be connected with counselors, social workers, nurses, or other trusted adults in their community. Regional crisis lines, or 988, the National Suicide Prevention Line. Local law enforcement and emergency responders. Child Protective Services, and sometimes 911. This range of responders makes HearMeWA the first of its kind in the country. For example, in other states with youth crisis hotlines, reports are only sent to schools. And unlike other crisis hotlines, HearMeWA allows users and responders to track and follow up on reports so youth are not cut off from help after that first contact ends. Youth up to age 25 can utilize this service, and reports can, of course, be made anonymously. This is not a substitute for 911 in an emergency. If someone is threatening to end their life right now, for example, that requires a 911 call. We take that very seriously. I want to emphasize that this is a starting point, not an end point. This program is not a cure for a lack of youth services and resources. Our hope is that as we develop this program, we can help identify gaps in services to help policymakers address them. HearMeWA represents a significant step forward, ensuring all of Washington's youth can get the help that they need when they need it. So with that background, I'm going to turn first again to McKenna will speak, followed by Connor, followed by Senator Brown, and just want to say how much we appreciate all the youth who are here today, the many youth who have been involved in this project, and for the young people who are speaking today at a press conference, I just really appreciate their willingness to come forward, sort of publicly speak before a bank of cameras and to the media about their experience and why this program is so important to them. McKenna.
Hello, my name is McKenna Crosser, and I am currently a sophomore at Bainbridge High School. I am so excited that we are launching HearMeWA to help youth in Washington. As a young person, I've dealt with stress and social anxiety due to having a speech disability. Since I was 3, I've had a speech impediment and struggled with articulating and pronouncing sounds correctly. Growing up, this made it hard for me to freely express my thoughts with my peers, and I remember always being self-conscious and stressed about how I would correctly convey what I was thinking with my peers. I didn't feel like there was anybody that could understand what I was feeling, and it would have been wonderful if I had a program that was available where I could have someone to talk to. I'm very glad that the AGO has realized that youth are struggling, and sometimes with even more severe issues, or they are in crisis and need a place to turn to. I think that the creation of this program is so important because it provides a safe place where youth can be listened to, but it is also a place where youth can report concerns regarding violence and safety issues. This is a specific program for Washington's youth to be heard because currently they are not being heard enough. I'm proud to be part of the HearMeWA Youth Advisory Group. It is so important to have young and diverse perspectives to make our program the most suitable for the youth who will have access to it. We have already provided feedback on a prototype tip survey as well as the design of a webpage and flyer. All of these commentaries are made while thinking of how the youth will All of these commentaries are made while thinking of the youth and how they will utilize these services that HearMeWA provides. Jose Rizal emphasized the importance of children and adolescents as he said, "The youth is the hope of our future." I know that this program will be able to successfully help youth struggling with safety and well-being issues. I hope that HearMeWA can be used as a resource for Washington's youth so that they know that they are supported. Thank you.
Sure. Thank you all for being here. First and foremost, I'd like to extend my deepest gratitude to my friend Sharon Brown for her unwavering dedication and commitment. She listened earnestly to a young constituent and never gave up on this program until it became a reality. I'm also grateful for the Attorney General and his office, who will serve as stewards of this program, which has the potential to help so many in our community. As you heard, my name is Connor Mertens. I'm from Kennewick, Washington. In 2014, I became the first college football player to come out publicly, which gave me a platform and a megaphone to try and make change, especially in my quiet little corner of Washington. The idea for HearMeWA was born out of a tragic string of youth suicides in my hometown. Growing up in an area with a lack of resources, mental health was often a topic that was overlooked or even disregarded entirely. But the issues facing the youth in our state are universal. They transcend political affiliation and touch us all. Suicide, interpersonal violence, bullying. These are all problems that any decent person, regardless of their creed or their persuasion, would agree should not be shouldered alone, especially by our state's youth. In a time when it's easy to be cynical about politics, this is proof that the system can work for us and by us. While I'm immensely proud of the work we have accomplished to bring HearMeWA to life, our journey does not end here. This initiative is just the beginning. It is to be a beacon of hope for those who are struggling and a call to action for all of us to continue advocating for mental health awareness and support systems. I'm especially encouraged by the presence of our youth advisors that are here today. Your involvement and insights are invaluable. You are the voice of your generation, and your participation ensures that HearMeWA will truly meet the needs of those it is designed to help. As a high school soccer coach here in Seattle, I've seen firsthand the power of our youth's voices and their actions. Together, we can build a community where mental health is prioritized, not stigmatized, where no one feels alone in their struggles, and where every individual has access to the support that they need. Thank you.
Good afternoon, everyone. What a great reason to be here in Seattle. Thank you to AG Ferguson and members of the advisory committee for inviting me to participate in today's press conference. It's truly an honor to be here. As many of you know, I've spent a significant portion of my career, both inside and outside of the state Senate, focused on improving our state's behavioral health system, advocating for suicide prevention. But there's one area that continues to hit particularly close to home: teen suicide prevention. It's a heavy topic, but one that we as a society desperately need to address. Statistics tell a grim story. Suicide is one of the leading causes of death for young people ages 10 to 24. According to the most recent numbers from the CDC, suicide rates for our youth increased from 2007 through 2021 from 6.8 deaths per 100,000 to 11. That's just unacceptable. And then increased again through the pandemic. The American Psychological Association has found that more than 20% of teens have seriously considered suicide, with one of the most alarming trends in recent years being a sharp rise in suicide among youth of color. In the Tri-Cities, we hit a crisis point in 2015 when 43 people died of suicide. 10 of them only being 15 to 24 years old. This spurred a community conversation about teen suicide. We could not stand idly by. Collaboration on this issue is absolutely crucial. Policymakers, advocates, families, communities, we all have a role to play. During my time as a lawmaker, I had the privilege of collaborating with Connor Mertens, a young, remarkable man who you just heard from. Connor lost a friend to suicide, and that tragedy fueled his passion to make a difference. I got a text from him one night saying, "Hey, Senator Brown, you know, if you've got some time, I'd love to talk to you about this concept." That's when he pitched the idea of a tip line that could give youth the opportunity to reach out for help before the crisis stage. I then reached out to Kirk Williamson with the Benton Franklin Community Health Alliance in Kennewick. He looked at the metrics and successes of youth well-being and health tip line apps in other parts of the U.S. We researched, we talked, and we listened. We worked together, and the result was the Youth Empowered to Speak Up legislation. Later, I introduced the Youth Behavioral Protection Act, which requires the state healthcare authority to take action aimed at facilitating the integration of behavioral health with primary care. We also successfully fought for an unprecedented level of funding in the state's budget for mental health needs. These actions aim to empower young people to identify the signs of suicide in their peers and provide them with the resources they need to seek help. And they wouldn't have been possible without Connor's bravery and the coming together of our community. This effort doesn't end with the passage of legislation. It's about fostering open communication within families, creating safe spaces in schools, and ensuring our communities have access to the mental health resources that they need. I want to thank the members of the HearMeWA Washington Advisory Committee for continuing these efforts and for your dedication to improving youth mental health. In my current role as CEO at Greater Health Now, I see youth suicide prevention as falling squarely within our mission of building a healthier Washington. We know that mental health is just as important as physical health. By working together, we can create a safety net for our youth, a network where they feel comfortable speaking up and reaching out for help. Every student who is feeling overwhelmed and alone, every veteran on campus suffering from post-traumatic stress disorder, every victim of bullying who feels like they can't take another minute, they each must know that they can reach out for help, and that if they do, that critical aid will be there for them. We must honor those we've lost by continuing to work tirelessly to prevent future tragedies. I'm absolutely sick and tired of the political bickering that stands in the way of good policy. Let's empower our youth, listen to their voices, and ensure that they know they are not alone. Thank you.
Thanks so much to all three of our speakers. Sharon, you know, it's I often say when folks ask me, sometimes I'll speak at a group of people and they say, how do you get a bill passed through the legislature? And I say, well, there's a lot of things that go into it, but I always say the most important thing you need is not just legislators who support your idea, but you need a champion, right? You need someone who's like, this is my mission to get this thing across the finish line, because there's so many competing bills, there's thousands of them. So obviously you stepped up in a significant way, so thank you for doing that. And importantly, listen to Connor, right, when Connor reached out, right? And another thing you need for legislation is obviously a good idea, and the best ideas often come from individuals who are impacted by an issue. And Connor, obviously that was you, right? And you're willing to reach out to your local elected official, share your story and what was going on, and we were fortunate to have an elected official who listened as well. And McKenna, for you and all the other young people here to help take these ideas and this legislation and bring it to where we are, you know, it takes folks who are willing to speak in front of a group of people and to attend these meetings and craft this program in a way that works for so many people. So thanks to you and so many others. Just the last thing I'll say before we take your questions, we were all in a conference room a few minutes ago before coming out here. What I mentioned to this group was, you know, as a parent, my twins are now 16 years old And so, look, what I told them was, I think, every parent worries about their kids obsessively. Of course, that's the nature of being a parent, right? But for me, I think the things I worry about the most are mental health issues and chemical dependency issues. Because as a parent, you can be doing everything right, and your kid can still have those challenges, and those challenges are so difficult as a parent to help. And so it gives me a great sense of comfort that on issues related to mental health and all the issues we've talked about, that there's a resource for my kids if they ever need it. So if they don't want to talk to their dad, right, they can talk to somebody else, right? If they have another place they can go to get the help that they need. And so for all the folks who have made this a reality, I so appreciate it on behalf of my team that's worked very hard on this. So with that, we're happy to take any questions from folks here in the room. And I know we have folks in line, so what I'll probably do is try and repeat the question so folks in line can hear it, and then we'll turn to whoever wants to answer it. Yes, go right ahead.
Yeah, hi, my name is Jay, and with the Seattle Times. You mentioned that this will be kind of opening for rural communities as well. I was wondering if you could talk a little bit more about that. How do you kind of ensure that you can connect, not just rural communities, but how do you ensure that all these organizations, in whatever corner of Washington, you're trying to triage and connect people, how do you ensure that they respond?
So I'll repeat the question so folks could hear. So the question went to, with a particular focus on rural communities, how we make sure that we're reaching those folks and these different organizations are able to respond. So happy to open up to Camille. Camille, do you want to go first? Great. Maybe you might introducing yourself.
Sure.
That'd be great.
Thanks for the question. Camille Goldie. I'm the Youth Program Manager at the Attorney General's Office. Our team has done a lot of outreach with communities in the state, including rural communities, to try to track down resources that folks may not know about. And then we're also working with the 3 kind of searchable databases that are offered for youth services. So 211, Teen Link, the DOH Teen Health Hub. And we're helping the Crisis Center understand what's available in Washington, and they can kind of act as that connector for youth who may not know who to reach out to, or the adults in their community may not know how to find that. So we're working with the Crisis Center to bring up their skills and be able to help them connect those youth. Do you want to add anything?
Absolutely.
Good afternoon, everyone. Jessica Jackson here from the Crisis Center, National Crisis Center Director. And really great question. One of the things that I absolutely love about HearMeWA's concept and our work in the Crisis Center is that all of that information that Camille mentioned that we are going to be able to locate for the youth in need is also going to be in our database. So our schools, our districts, and those local law enforcement teams when necessary, our 211 partners are all able to collaborate and all together in one dashboard in one system. So there isn't a question sometimes, and I was a school teacher before, but sometimes, was this call given to local law enforcement? Did the student receive the services that they need? In our system and Hear Me Washington's program, school and districts and those partners will all be connected. So they'll be able to see exactly what's happening for that one youth in need.
Thanks so much. Other questions from folks here in the room? Yeah, go for it. Yeah, Paul, yeah.
So kind of following up on that, so can you talk a little bit more about how you plan to follow these calls as they come in? Let's say there's a high volume. How do you ensure that the students all get the services they need? How do you keep track?
Great. So the question was, how are we able to make sure that we're able to respond to all these calls? If there's an especially high volume, how do we track those? So I'll turn to, is that you first, Jessica? Great.
I'll take that one again. We currently have crisis center counselors. As the Attorney General mentioned, our program is 24/7, 365. We have a good amount of staff that are there and prepared to handle those tips. We do pride ourselves, as if you've seen the website, we do respond to those tips within the first 2 minutes. We are going to immediately connect with all youth, regardless of the tip type, whether it's bullying, whether it's a sexual harassment tip, whether it is suicide, depression, anger issues. All of our tips will be responded to by a live, trusted crisis center counselor who will then work with that student in need, that youth in need, and immediately provide those resources. 100% of the tips and every single tip will be responded to and handled correctly. Additionally, if there is a connection to a school or a district team, our crisis center counselors will work immediately to ensure that information is sent over to the school and district as well.
Go for it. No, great.
As a former rural youth, retired youth of rural Washington, I don't want it to get lost on anyone, the power of just the existence of these tools. My passion for this also came from my own experiences with suicidal ideation. And I still vividly remember the time that I used the Trevor Project's hotline. I called, I heard a voice on the other end, and I hung up immediately. That's all I needed. I just needed to know someone was there. So I think we can't overlook the value of being there for rural Washington youth, but also, you know, just providing this resource and giving them an outlet could be life-changing. So little former youth perspective.
Thanks, Connor. Any other questions from your end, or are you good? Good. Yep, okay, great. Anyone else in the room before I turn to the phone line? And I will see, I'm not sure if we have folks on the line. It sounds like there's someone on the line. Does anyone on the line have a question for us? If not, we'll maybe take your last one. Yeah, go for it.
Are you planning to hire more staff at the national and that crisis center to accommodate this?
Great, so the question is whether more staff will need to be hired sort of at the national level.
The answer is yes. So we currently have the right amount of staff as we have seen it when we look at trends and data, but there always is the ability at any point in time to hire the staff. I will say that our staff goes through rigorous training before they are able to respond and say hello on the system. And so we currently do have a process and a system in place. Our staff go through more than 200 hours of training before they are able to work with youth in need to ensure that they are providing that specific support that they need. So yes, absolutely.
Thanks. And folks are available afterwards as well if you have individual questions. But just to wrap up, first, thanks to everybody who's here. And there's, of course, many people who could not make it here today physically, but were a huge part of this project and bringing it together, from the elected officials to the youth to everybody who's made this happen. It's been a big team to make it happen. The thing I'll just say is, you know, it's not too often the folks who are here that, you know, you can say you're part of a project that will literally save lives. You know, that literally will save lives. You know, that is, you know, that's not a common experience, but you know, this certainly will. There's just no getting around it. And so, Connor, I appreciate you sharing your story of, you know, making that phone call, and literally just hearing someone's voice sound like for you in that moment, like that was enough, right? It's all you needed in that particular moment. So the idea that for, you know, so many other youth in our state that they have that voice, right, that picks up the phone and responds to that message, you know, will literally save lives all across our state. So appreciate all of you being here, all the work that went into it, and hope you all have a wonderful day. Thank you so much.